Ever wondered why managing blood pressure can be such a challenge, particularly for those with insulin resistance? Well, it's not as straightforward as it might seem. Hypertension management is complex, influenced by a plethora of factors. Physiological aspects like sympathetic nervous system activation and the overactivity of the renin-angiotensin-aldosterone system can elevate blood pressure. Lifestyle choices, poor diet, sedentary behavior, and excessive alcohol consumption also play their part. Treatment-related factors such as lack of adherence to medication and the efficacy of drugs can hinder blood pressure control too. And then we have conditions like insulin resistance and metabolic syndrome. These can make hypertension even harder to manage by increasing sodium retention, altering vascular function, and triggering inflammation. Age-related changes and chronic stress further add to the mix. So it's clear that insulin resistance significantly complicates the management of hypertension, but how exactly does this happen? To understand the relationship between insulin resistance and hypertension, we need to delve into the mechanism of insulin resistance. Simply put, insulin resistance is when the body's cells don't respond as effectively to insulin, the hormone responsible for regulating sugar levels in the blood. Over time, this can lead to higher levels of insulin in the blood, a condition known as hyperinsulinemia. Now, how does this tie in with hypertension, you might ask? Well, hyperinsulinemia can lead to increased sodium retention in the kidneys. This means more water is retained in the body, increasing blood volume and consequently blood pressure. Additionally, insulin resistance can cause alterations in vascular function, making blood vessels less flexible and more resistant to blood flow, thus raising blood pressure. There's also a link to inflammation, which can damage blood vessels and further contribute to hypertension. Now that we've unraveled the mechanism, let's summarize what we've learned. So, what are the key points about insulin resistance and hypertension that we need to remember? Well, let's recap. First, insulin resistance and hypertension often go hand in hand. This is because insulin resistance can lead to increased sodium retention and inflammation, both of which can contribute to high blood pressure. Second, managing these conditions is not just about taking medication. It's also about making lifestyle changes such as adopting a healthier diet, increasing physical activity, and managing stress. Third, it's important to understand that not all hypertension is the same. Some people have low renin hypertension while others have high renin hypertension. These two types require different treatment approaches. Lastly, remember that some individuals are particularly sensitive to sodium. Even a modest sodium intake can significantly raise their blood pressure. Remember, understanding the interplay between insulin resistance and hypertension can help in devising a more effective management strategy for these intertwined conditions.